The Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. What reports has he received?
Order. I'm going to ask the member to start again. I don't. She had a fair go. The Honourable Annette King, question number 3.
My question's to the Minister of Health. What reports has he received, if any, on the pressures facing the public health workforce?
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, I've seen a report, on behalf of the Minister, I've seen a report saying that the funding for health has gone up over $4 billion under this national government, and only a national government can both handle the country's finances and deliver more health services.
Supplementary question.
Supplementary question, the Honourable Annette King.
Has he been advised of the huge pressure on staff working in emergency departments because of the increase in the number of mental health patients requiring care, the number which have doubled in some DHBs under this government's watch?
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, on behalf of the Minister, what I've been advised is funding for mental health and addiction services has gone up from $1.1 billion in 2008 to $1.4 billion under the current financial year. Sir, the police and the Ministry of Health are working together to coordinate and responsibilities around mental health services, and there's a stronger drive to encourage people who are experiencing mental health problems to seek help.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
In light of the Minister's consistent answer that there is more money in health, can he explain why the number of call-outs for adult mental health community services are spiralling out of control and staff have reached the end of their tether?
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, I say again that the funding for mental health services has gone up from $1.1 billion to $1.4 billion. In fact, the proportion of police referrals against total referrals has actually dropped from 5.2% to 4.2%.
Question, Mr Speaker.
Supplementary question, the Honourable Annette King.
What impact does he believe giving mental health services a 0.52% increase in funding in 2014-15 is having on mental health staff's ability to provide timely services?
The Honourable Pesata Sam Lotu-Iiga.
Well, I say to the member, verify those figures, because she's brought figures like that into the House that have clearly been, patently been incorrect. But what I will say is that these services are being coordinated quite well between the Ministry of Health and police. And again, as I said, $1.4 billion has been spent in this area.
Supplementary question, Mr Speaker.
Order. Supplementary question, the Honourable Annette King.
Has he been advised that the number of call-outs for people needing mental health services in the community in just 12 DHBs has increased to 30,000 in this year to June alone, a record 20% increase?
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, again, I don't have that member's figures, or don't know where that member gets the figures from. But what I can say is that $64 million has been invested over 4 years to support young people with mental health under the Prime Minister's Youth Mental Health Project. $1.4 billion is being spent on mental health services.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Does he think it's appropriate for police to be handling up to 100 call-outs a day to manage mental health patients while the government refuses to cover all the cost pressures in health, which the Minister of Health has admitted in this House?
The Honourable Pesata Sam Lotu-Iiga.
Sir, on behalf of the Minister, the police have developed new training resources to assist in developing their skills. And they've spent money to work alongside the Ministry to provide these services.
Answer the question.
Point of order, Mr.
I can
Speaker.
anticipate the point of order. I'll invite the
thank you.
member
I did
to ask the question again.
Does he think it's appropriate for the police to handle up to 100 call-outs a day to manage mental health patients while the government refuses to fund all the cost pressures in health, something that the Minister has admitted in this House?
The Honourable Pestas and
Well, I dispute the second part of that Minister's assertion, because the cost pressures in terms of health have been covered in this budget to the tune of $330 million.
Mr Speaker.
A point of order.
Mr Speaker, you listened very carefully to that answer, and the Minister disputed that the Minister of Health had made that comment. And am I required now to table the Hansard to show that's exactly what the Minister said?
The member is certainly not entitled to even attempt to cancel the Hansard. The question, when I listened to it a second time, was probably answered the first time, in that the question alleged, according to the member asking the question, that the government had refused to fund the increase, etc. The Minister certainly addressed that. He disputed it. Question. Order. Question number 4.